Hi, I'm Claire Swanson.
And I'm Davy Schlasko.
We worked with Mount Ascutney Prevention Partnership to create this series, highlighting ways we can make communities more welcoming and affirming for LGBTQ plus youth.
We interviewed about a dozen people, including parents, teachers, librarians, social workers, all kinds of people who work with youth, most of whom are also LGBTQ plus themselves, and so used to be LGBTQ plus youth, who can speak from their professional perspectives, but also from their own personal experiences.
Davy and I also bring our personal experiences as well as professional skills to this project. I am a queer young adult who was recently a youth in this region. I grew up in the Upper Valley. I've been here my whole life. And I also am somebody who works in videography, particularly working with nonprofits. So this project is really important to me because I'm glad that I get to use these skills to help people like me.
And this project is really personally relevant for me as well, because while I'm a little bit farther from being a youth, I also grew up in an area that's a lot like this, that's very rural, primarily white, and that actually is fairly gay friendly as these things go. Like, I didn't encounter a lot of outright hostility. But just like I think, people around here want to be supportive of all of the young people in these communities, but sometimes wanting to be supportive isn't quite enough. Sometimes people need a little bit more information or a little bit more skills or tools to be able to really effectively make an inclusive, safe, welcoming environment for LGBTQ young people. One of the things that I think about in terms of where I grew up that also may be true for many people here is because it's a predominantly white area, even to the extent that I met other LGBTQ people, which wasn't very much, pretty much all of them were white. And so that gave me, as a queer young person, a really incomplete idea of what queer and trans community can be like, and would have been even harder in different ways for queer or trans youth of color in that kind of environment. So I think a lot about what queer and trans rural youth need from their communities, and also about all of the beautiful strengths and contributions that they bring. And I really hope that the perspectives in these videos can help folks feel more informed and confident to really make these communities healthy and welcoming places for LGBTQ plus youth.
Before we go any further, we want to acknowledge that viewers may have different levels of familiarity with some of the language that we're using. What is the definition of sexual orientation?
Yeah, great question. This is one I think we really take for granted. And for me, sexual orientation is actually way more complicated than how we usually talk about it. So usually in North America, when people talk about sexual orientation, they mean who you're attracted to, romantically and or sexually, in terms of your gender and their gender. So like heterosexual attracted to people of a different gender, homosexual attracted to people of the same gender, right? All of those kind of formal words for sexual orientations are about the genders of the two people. But when we think about sexual orientation more broadly, we can also think about how emotional attraction can be different sometimes than romantic attraction, about how someone's sexual behavior isn't always what you would guess based on their sexual orientation label. People make different partnership choices, even within the same sort of sexual orientation group, have different relationship structures, use different words to describe themselves, and are part of different sexual communities or different dating communities. So when you know what someone's sexual orientation is in terms of what word they use, like straight or gay or lesbian or queer, you don't necessarily know anything about what sexual or dating behavior they are or aren't doing.
And what is gender identity?
So gender identity is probably mostly what you usually think when you think of gender. It's who you are inside, who you know yourself to be in terms of gender categories like man, woman, boy, girl, and so on. One way to shortcut that is if biological sex, like your body parts, is biological, gender identity is psychological. It's in your mind and your heart, who you know yourself to be as a gendered person. Gender identity is not exactly the same as gender expression. So you already know that not everyone who is a woman dresses or acts really feminine. Being a woman is a gender identity. Acting feminine is gender expression. So people of all gender identities can express their genders in all kinds of different ways.
And what is LGBTQ plus?
You know, there are so many words that we could be using, that we could be defining, and we're not going to define any of them. The acronym LGBTQ plus stands for lesbian, gay, bisexual, trans, queer, questioning, and more and more and more. And anything else that people might use to define themselves, any other word people might use to define themselves that's different than this sort of mainstream norm, straight cisgender norm. Within that, there are a lot of different words that we can get more specific about, and there are glossaries that you can look up. A few of them that I'll touch on right now, just to dig into that acronym a little bit more. One is queer, which we've already used a few times, and it's a confusing word because different people use it in different ways. Historically, queer has often been used as an insult, but almost from the same moment it started being used as an insult for people who aren't straight, people started reclaiming it and saying, yeah, I'm queer, and that's awesome. So it is sometimes an insult, and it's also a reclaimed term to talk about pretty much any gender or sexual identity that's outside of the mainstream norm. Another one on here that I want to highlight is trans or transgender. They mean basically the same thing. And it's a little broader than how you might have heard it defined. These days, when people talk about trans, they don't necessarily mean someone who's doing something medical to their body to change it. They mean anybody whose gender identity now, remember, gender identity is how you feel about yourself inside, who you know yourself to be as a gendered person. Anybody for whom that internal gender identity is different than the gender people guessed based on what your body looked at like at birth. So if someone's born and the doctor says it's a boy, and then the kid grows up and says, I'm a girl, that person would probably identify as a trans girl. Trans also includes people whose gender identity is non-binary. And non-binary just means literally outside of the two category system. So anybody whose gender identity is not simply man or not simply woman might identify as non-binary or might describe their gender identity as non-binary. And just like this picture implies, there can sometimes be barriers in the world for non-binary folks because so much of the world is built on a binary assumption, is built on the assumption that everyone is simply a man or simply a woman. And when that's not true for you, it can get kind of complicated to navigate organizations and systems. One thing that's important to remember about the word non-binary is that it doesn't mean just one thing. Non-binary means any identity that's not simply man or simply woman. And there are lots and lots of different ways that people might feel and understand their gender identities that could be described as non-binary. Some people might say, I am somewhat of a man and somewhat of a woman. Some people might say, I'm not a man or a woman. Some people might say, well, I'm like a boyish girl. There are all kinds of different ways people might use to try to describe a non-binary identity using the very binary language that we have access to. But they don't all feel the same. They don't all look the same. Each and every non-binary person you meet might have a little bit of a different gender identity from each other. Another word that often gets confused with non-binary is gender fluid. Gender fluid people encounter many of the same barriers, but for a slightly different reason. Gender fluid means anyone whose gender identity is not necessarily the same from day to day. So maybe some days they're more of a man, some days they're more of a woman, some days they're more non-binary, some days they're more another kind of non-binary. And not all non-binary people are gender fluid. Some people are non-binary in a very consistent way. But both non-binary people and gender fluid people can encounter some of the same barriers where the world just isn't set up on the assumption that people like this exist and are part of all our communities.
Could you talk a little bit about pronouns?
Right, of course. So often when we talk about trans people or trans inclusion, we end up talking a lot about pronouns. Pronouns are words like he, she, they, we, you, I, all of these words that you use in a sentence instead of repeating somebody's name. Why we talk about this in terms of gender is that he and she, of course, are really gendered. And when somebody has a different gender identity than what other people might guess, it can often be really painful and common experience to get called the wrong pronoun. And so when we think about creating an inclusive and welcoming environment for LGBTQ plus youth, and especially trans and non-binary youth, making sure to call people the pronouns that they want to be called is a really important part of that. One way that you do that is to find out what pronouns people want to be called. The shortest way to explain that is it's better to ask than to guess wrong. And it's especially good to ask and tell people why you're asking. Usually the reason that you're asking is because you're about to have to use a pronoun about them, right? I'd like to introduce you to my friend. So what pronouns do you use? Or maybe I might have to talk with my colleague about you after our appointment is over. So what pronouns should I use about you there? Like he or she or they or something else. And that way you can know for sure how somebody feels most respected rather than trying to guess and sometimes getting it wrong.
Could you define the word transition?
So transition is a word we use to describe the experiences of people whose gender experience shifts during their life. Not necessarily their gender identity, but how they're living their gender publicly in the world. So when you go from living your life as one gender to living your life as another gender, that's gender transition. It doesn't only mean medical transition, like changing your body. It also includes stuff like changing your name, either legally or sometimes just socially. It includes social transition, like just asking people to call you a different pronoun. Sometimes it includes really personal or even spiritual transitions, really changing the way that you think about yourself in the universe. So all of those pieces, personal, spiritual, legal, medical, social, all can be part of what we call gender transition. And a really parallel term is coming out. So pretty much, I think most people have heard the term coming out, meaning disclosing that you're not straight, right? Saying, I am a, whatever it is, I am a lesbian, I am a queer person, that's coming out. But coming out isn't always just a declaration of I am a blank. Particularly for trans people, sometimes just saying something that's true about our past is a kind of coming out. So when I talk about when I used to be in the Girl Scouts, whether or not I mean to be coming out as trans, that is a coming out moment. And people, if they didn't know already, are going to know then. That sometimes happens in terms of sexual orientation too. Someone might not have to say, I'm gay. They might just say, well, my boyfriend, and then you know. And that also is a kind of coming out. So coming out isn't something that people sort of do once and then it's over, like a coming of age ritual or something. It's something that we really end up doing over and over again, day to day throughout our whole lives. And just by coincidence, when we're recording this, it's about to be National Coming Out Day, which is October 11th, which is a day to sort of celebrate that some of us are safe enough to come out in our communities, and also to celebrate all the different ways that we can come out to ourselves or to our closest people, even without necessarily being out to the whole wide world. People often wonder how many youth even are LGBTQ. Sometimes we might get into the habit of assuming it's a very small group, but actually it's way bigger than you might think. So starting on the top right over here with these two purple boxes, about 13% of Vermont youth identify as LGBTQ+, lesbian, gay, bisexual, queer, or some additional word within non-straight community. And on top of that 13%, another 6% identify as questioning or say that they're not sure. So altogether, about 19% of Vermont youth, or almost 1 in 5, are not simply heterosexual. When we think about gender, over here on the top left, about 2% of Vermont youth are trans. So 1 in every 50 of the youth that you know are trans. And on top of that, another 1% are not sure or identify as questioning. So in total, 3% of Vermont youth are not simply cisgender. Cisgender means not trans. So 3% of Vermont youth are trans or maybe trans. These two groups overlap. So some trans people are also LGBT or queer. And when you put them together, overall 14% of Vermont youth are LGBTQ+, and 6% are questioning. So in total, a fifth of Vermont youth are not simply heterosexual and cisgender. People very often talk about statistics around risk factors for LGBTQ+ youth. And indeed, it's true that LGBTQ+ youth are more at risk or are more likely to experience various difficult experiences, various difficulties than their heterosexual and cisgender peers. Almost all of the statistics on this slide are true, but one of them isn't. So take a moment and think, which of the following is not true about LGBTQ+ youth? They're more likely to experience depression and anxiety. That's true. They're about 5 times as likely to report suicidal thoughts. That's also unfortunately true. They are more likely to smoke, drink, and use recreational drugs, all true. And I think it's important when we name that to also say that is because of the stress of homophobia and transphobia and harassment and discrimination that people end up turning to those unhealthy coping behaviors. They are about half as likely to feel like they matter to others in the community. Only 37% of LGBTQ+ youth in Vermont say that they feel like they matter in their communities. They are more likely to have spent at least one night away from home in the past month because of being unwelcome or unsafe there, also definitely true. They're more likely to have had sexual intercourse. Believe it or not, this one also is true. And I know this is very confusing, but going back to the definition of sexual orientation, identity is not the same as behavior. So even youth who identify as LGBTQ may sometimes have the kinds of sexual intercourse that can lead to pregnancy. What's not a risk factor, but a really positive thing, is they are more likely to have been tested for sexually transmitted infections if they needed to be tested. And skipping over to the orange, they are less likely to suffer a concussion while participating in sports, so that's another positive. The one that's not true is this yellow one here, that is, they're more likely to be using reliable birth control. It's not true. Even though LGBTQ youth are more likely to have had sexual intercourse than their heterosexual peers, they are less likely to be using reliable birth control. And that leads to a very confusing statistic that's found across almost all states' youth risk behavior surveys, that lesbian youth are more likely than heterosexual young women to have an unintended pregnancy. And again, that's just because identity is not the same as behavior. And when we're working with youth to help them be safe in the world, we need to remember that we can't always know what situations they'll encounter or what behaviors they might be doing just because of the one identity word that we know about them. I always think it's important to talk about what's going well for LGBTQ youth, as well as what might be hard. One way we talk about this is in terms of resilience factors. What are the things in a youth's life that make all the other stuff easier to bear, easier to handle? The very biggest thing that helps youth survive and thrive is having support from their families, from their communities and peers, and from allies. In fact, family support is so powerful that, for example, for trans youth whose families support them to use the name and pronoun that they want to use, their levels of depression and anxiety are almost as low as their cisgender peers. All of that huge difference in risk factor around mental health disappears just from having family support. In fact, support is so powerful that even if you don't have your family's support, having even one supportive adult in your life reduces the risk of depression, anxiety, and suicidal thoughts. And for everyone watching, I want you to really consider Could I be that one supportive adult for somebody? It's actually not that hard. And you can make such a huge difference. Some other things we should know about that people really need at all ages and that are resilience factors that help folks survive all of the risks that they may encounter include access to affirming healthcare, even if that's by telehealth. If there's not an LGBTQ friendly provider in your town, being able to talk to one who is can be very helpful. Getting called the right name and pronoun, and time since transition or coming out. That last one is not something we have control over, right? But I think it is really useful to remember that not all of the LGBTQ plus youth in our communities are brand new to this. You might meet a 16-year-old who's been thinking that they might be bisexual for like a month, and that person might have very different needs for support and community than a 16-year-old who's been really clear about their sexual identity since they were 12. So all of that was a lot. If this is new information for you, or if you haven't thought a lot about these issues or these communities, this is a great time to take a deep breath and maybe take a moment to think through what you just heard and saw. What was new to you? What new questions do you have? And what does this mean for you in terms of including and supporting people in your life? Many of the interviews that we've worked on will answer some of these questions. But you can also go look for answers in additional places. And we put together just a few resources that might be helpful to get started. If you want support in creating a more welcoming environment for folks in your community, or if you want more support for yourself in your community, all of these are really useful organizations that you can check out, find the resources that they have to offer, the information, the support, and get what you need.
I'm Taylor Small. I use she and her pronouns, and I wear a whole variety of hats, one of them being recently elected to the Vermont legislature as the first openly trans individual to serve here in the state of Vermont, as well as the director of the health and wellness program over at Pride Center of Vermont.
So I'm Tiffany, and I use she, her, hers pronouns. I work at the university. I'm the Crossroads coordinator, so I work in the Gender and Sexuality Campus Center and the Multicultural Student Center. So I serve queer and trans students of color, basically.
My name's Jenna. I use they, them pronouns, and I live in Western Massachusetts, but I grew up in rural Vermont, in northern Vermont. And I work for an agency called Community Action, and they work in their youth and workforce development programs. And my title is as a youth access partnership coordinator. And the project that I'm working on is grounded in positive youth development frameworks to increase access to quality healthcare for LGBT youth and youth of color.
My name is Jay Botsford. My pronouns are Z's or Zers, or they, them, theirs, which is really just an out that I give to people because folks aren't actually comfortable using pronouns, mostly beyond he and she, but definitely not beyond they. And I mean, my background has been as a youth worker from the age of 15, although I didn't start doing LGBTQ plus youth work in a focused way until I was 18.
I'm Fabio Ronaldo, he, him pronouns. I've been living in Vermont for about 3 years. My background, I started off as an educator, then transitioned into youth development work, and then did my grad school work in conflict resolution. And I'm working right now as a resident dean at Landmark College. Grew up as a queer kid, still am today.
So I am Kendra. I am a queer adult living in the Upper Valley. I was a queer teen growing up in a rural part of the Upper Valley about 30 years ago. And I am currently an aunt, a friend, a confidant for lots of kids and teens, some of whom identify somewhere on a spectrum of queerness and gender nonconformity.
My name's Sarah, obviously, and I use they and he pronouns. I was raised in like mostly rural Florida, but rural anywhere. I'm an Army brat, so definitely curious about some of the differences in experiences and similarities in experiences between young people when I was growing up and young people now.
My name is Hannah. I am a queer woman who's currently living in central, semi-rural Vermont, went to high school in rural Vermont, and grew up in, small rural schools in communities in Vermont. And I'm also coming to this with my lived experience and also as a student of education of right now of early childhood education.
I'm Nathaniel Flynn. I use he, him, or they, them pronouns, again, depending on who I'm with and where I am. I'm a preschool teacher, and I'm also part of Gender Justice in Early Childhood, which is a group of teachers and parents and academics, activists, therapists, and artists who work together to build resources and trainings and community to foster gender justice in early childhood.
My name is Shauna. I use she, her, or they, them pronouns. I identify as a queer femme, white person, and I've been working in libraries for over about 12 years. I've been working with public librarians the most, and how, kind of counseling them on queer-related issues.
My name is Romina Pacheco. I use she, her pronouns. I am here mainly in the role of parent. I have two children, one 2-year-old and an 11-year-old who is going into the 6th grade. I'm also an educator. That's what I do as a profession, who focuses mostly on social justice.
My name is Alice Barber, and I'm here in 2 roles, I think. Well, maybe 3, actually. So the first and most important is that I am a mom to a 10-year-old named Jess, who came out as trans in 1st grade and now is a rising 5th grader and is identifying as non-binary. The other 2 hats, one is that I'm a therapist for children. The last is that, I am a middle-aged queer person and grew up in a time and came out in a time that is not like it is now.